A tubal reversal, also called microsurgical tubal anastomosis or tubal reanastomosis, involves microsurgical techniques to open and reconnect the fallopian tubes segments that have been previously ligated. Tubal ligation is the general term for any surgical procedure that blocks the fallopian tubes to prevent pregnancy and is usually intended as a form of permanent surgical sterilization. For a pregnancy to occur naturally, sperm must enter the fallopian tube through the uterus after being deposited in the vagina during intercourse. The oocyte or egg is released from the ovary and is picked up from the other end of the tube. When the fallopian tubes are blocked, the sperm and eggs are kept apart and fertilization is thus prevented. There are many methods that are used to ligate the tubes which can affect the ability and success of doing tubal reversals. Ligation methods that damage the least amount of tube usually result in a higher pregnancy rate after reversal. Success rates are also dependent on other infertility factors such as female age greater than 38 years, diminished ovarian reserve, pelvic adhesive disease, presence of male factor infertility, which can affect the chances of pregnancy despite having open fallopian tubes. In general, 50 to 75% of couples with no other fertility factors present usually become pregnant within 1 year of having a successful tubal reversal. Women may be able to have several different pregnancies for the price of one surgery, and the risk of twins or triplets is very low, but the risk of a tubal pregnancy is 10 to 15%, and the woman must have close follow-up after a positive home pregnancy test until the location of the pregnancy can be verified to be in the uterus and not in the fallopian tube. You must bring or request your tubal ligation operative note dictated by the doctor who performed your procedure and your surgical pathology or tissue report if portions of your tubes were removed. These reports give the type of tubal ligation, the amount of tube that was removed or damaged, and note such findings such as adhesions or scar tissue, or other problems that could affect the success rates, even the possibility of doing the tubal reversal itself. We recommend some hormonal tests be done on the 3rd day of your menstrual cycle and a semen analysis on your partner. If the operative note is not available, a diagnostic laparoscopy, which is placing a small telescope into your abdomen through your belly button, can be performed to evaluate the amount of tube that is available for reanastomosis. Good candidates for tubal anastomosis surgery should have regular menstrual cycles and ovulate spontaneously with a normal day 3 FSH and estradiol levels, should have a body mass index less than 30, and have had a type of tubal ligation that is amenable to reversal. And the male partner should have a normal semen analysis. If you are not a good candidate for tubal reversal, or if there have been other infertility factors involved, such as male factor, in vitro fertilization may be the preferred method for attempting pregnancy. We have worked diligently to reduce the cost of the tubal reversal. Our global fee for tubal reversals is $6,500, which includes the pre-op evaluation, operating room expenses, anesthesia, lab work, and the surgeon's fee. Payment needs to be received at least 2 weeks prior to your surgery. The tubal reversal procedure generally takes 2 to 3 hours and is performed in our private, state-of-the-art outpatient surgical facility located adjacent to Prague in Greenville. In order to minimize post-op discomfort, reduce formation of scar tissue, and shorten your recovery time, we perform your tubal reversal through a small incision right above the pubic hairline that is 3 to 5 inches long. Gentle tissue handling and not using mechanical retractors also help to minimize your post-op pain and increase your chances for successful pregnancy. Most women return to their normal activities within 5 to 10 days compared to the standard 2 to 3 day hospital stay and 4 to 6 weeks recovery period after an inpatient tubal reversal surgery. You are able to attempt conception 2 weeks after surgery. If you have not conceived within 6 cycles after your reversal, we recommend further evaluation with an hysterosalpingogram or HSG, which is an X-ray performed in our office to ensure that your tubes are still open.